Hey everyone, ready for a deep dive into something pretty amazing? Like, imagine HIV treatment that's almost like magic, especially for folks who have trouble with those daily pills. That's what we're going to be talking about today.
Yeah, it's a really exciting area with some big breakthroughs happening.
You got that right. We're looking at some hot-off-the-press research from UCSF, straight from the 2025 conference on retroviruses and opportunistic infections. And this isn't just another research paper, This is a potential game changer when it comes to HIV treatment and even prevention.
Absolutely. This study has some huge implications, especially for people who have a hard time sticking with those traditional daily pill regimens.
Yeah, and let's be real. Life happens, right? It's not always easy to keep up with a perfect medication schedule. We're talking about things like, difficulty swallowing pills or busy schedules or maybe even unstable housing that can make it tough to stay on top of your meds.
For sure, and those challenges can really have a snowball effect. Inconsistent medication intake, it doesn't just affect individual health, it can also increase the risk of HIV transmission in the community.
Yeah.
It's a pretty big deal with some far-reaching consequences.
And this is where things get really interesting.
Yeah.
The study we're digging into is the largest and longest one of its kind, and it's all about comparing long-acting injectable antiretroviral therapy, or we can just call it LAR for short.
Right. So with LAR, you get your HIV medication through an injection, and it lasts for a whole month or two instead of having to take pills every single day. This particular study looked at two groups of patients, those who were already doing well managing their HIV with those oral meds, and then those who were having a bit more of a tough time keeping the virus under control with pills.
So basically, they wanted to see how well this injectable treatment worked for folks who are already doing all right and for those who are struggling with the daily pill thing.
Yeah.
What'd they find?
The results are really quite impressive. After about 11 months, more than 98% of both groups achieved viral suppression.
Okay, now for anyone who might not be super familiar with that term, viral suppression basically means the virus becomes undetectable in their blood. And that is a huge win, both for individual health and also for public health efforts to prevent transmission.
Exactly. And what's really remarkable is that both groups, those who were already managing their HIV pretty well and those who weren't, both groups saw almost the same incredible results with this LAR.
Now that's a game changer. We're talking about injections that could potentially make it way easier for people to manage their HIV, no matter what their previous challenges were with those pill-based regimens. So what kind of meds were they using in this study?
They used a combo of long-acting cabotegravir and rilpivirine, and they gave it either monthly or every other month. And get this, the success rates they saw with this approach are already having an impact on treatment guidelines from big health organizations like the U.S. Department of Health and Human Services and the International Antiviral Society USA. That's how big of a deal these findings are.
Wow, that's pretty amazing. Sounds like we might be seeing a really significant shift in how we approach HIV treatment. Of course, with any new development, there are always some questions that pop up.
Oh, for sure. While this treatment has huge potential, we also have to think about things like, accessibility and affordability. How can we make sure that everyone who needs it can actually benefit from this breakthrough? That's definitely something we need to explore further.
Seems like we're just getting started here. For those of you who are eager to dive deeper, we're going to unpack more details about the study and what it all means in the next part of our deep dive. So stay tuned.
All right, so we've seen that this injectable HIV treatment, it's gotten some pretty impressive results, but maybe we could kind of pull back the curtain a little and look at how they actually did this study, you know what I mean?
Yeah, good point. It helps to understand how they got these results so we can see why they're so important.
Exactly. So where did they get all this data from? What kind of patients were in the study? Well, the researchers, they used this program. It's called the Special Program on Long-Acting Antiretrovirals to Stop HIV, or CLASH for short. And it's based at Ward 86. That's the HIV/AIDS clinic at Zuckerberg San Francisco General Hospital. So, UCSF.
So it's like a real-world setting, not just some lab experiment, right?
Uh-huh.
That makes it even more interesting because you could see how these findings might work for people living with HIV every day.
Absolutely, yeah. They had data from 370 patients, and it was over almost 3 years, January 2021 to September 2024. And they were really focusing on two specific groups within those patients.
Okay, so let's break it down a little. Who were they looking at specifically?
So one group, there were 129 patients, and they had what's called a detectable viral load when they started this injectable treatment. So basically that means the virus, it was active in their system and they weren't really suppressing it successfully with their previous treatment,
Gotcha. So that's our group that was having trouble managing their HIV with those like traditional methods. What about the other group?
The other group, there were 241 patients, and they already had their viral load under control. They were doing okay on the oral meds before they switched over to these injectables.
So those folks were already doing pretty well, but maybe they were looking for something, I don't know, like more convenient, less of a hassle to deal with.
Exactly. And by comparing these two groups, the researchers could see how effective this LA-ART really was, both for those struggling and for those who were, stable already.
And what'd they find? Did both groups have, like, similar success with the injectable treatment?
Yeah, it's pretty interesting. The results were really consistent across both groups. So after being on the injectable treatment for about 11 months, 99%, almost everyone who was already virally suppressed with the oral meds, they stayed that way, undetectable.
That's amazing. So it's just as effective as the pills for those who are doing well already? But how about that group, the ones who were struggling in the beginning? Did they see similar improvements?
That's what's so cool about this. The group that started the injectables with a detectable viral load, they did almost as well. I mean, 98% of them also achieved viral suppression in about the same amount of time.
Wow, that's incredible. It's really something to see those who were struggling before achieve the same level of viral suppression as those who are already doing well. It really shows you how powerful this treatment could be. Like it could level the playing field for HIV management.
Yeah, for sure. It's a big step forward in making sure everyone living with HIV has a chance to get to and stay at an undetectable viral load. And like we talked about before, that has huge implications, not just for individual health, but also for public health efforts to, stop transmission.
Absolutely. If more people can get to an undetectable viral load, well, we can really reduce the risk of HIV transmission out there in the community.
Exactly. And this study really shows that LA-ART, it can be a powerful tool to reach that goal.
So this is all super promising, but I'm guessing there are some, challenges and things to think about with any new treatment like this.
Oh, you're totally right. No medical breakthrough comes without its complexities, right? And one of the most important things to consider is access. As great as this treatment seems, we got to make sure that it's available and affordable for everyone who needs it, no matter their situation.
That's a really good point. It's one thing to have this amazing treatment, but it's totally different to make sure it actually reaches the people who could benefit from it the most.
Yeah, you hit the nail on the head. We need to look at things like the cost of these injectables, whether there are enough healthcare providers who are trained to give them, and, just the whole infrastructure needed to make this work on a larger scale. There are definitely some hurdles to overcome.
Sounds like we're talking about more than just a personal choice here. It's like a system-wide issue,
Yeah, that's a key point. To address these barriers, we need to think bigger. We need the policies that make access to affordable HIV care a priority, and we need to invest in training and education so healthcare workers feel comfortable and safe providing LA-ART to their patients. And then there's the stigma. We can't forget that. We got to work on getting rid of that because it can really prevent people from seeking the care they need.
It's definitely complex. But the potential benefits of LA-ART, they're so big, it's got to be worth figuring out, right?
I totally agree. The scientific breakthrough, that's just the first step. The real challenge is making this actually help people living with HIV.
So where do we go from here? What are the next steps to make sure this treatment can reach its full potential? We'll be talking about that and more in the final part of our deep dive. Stick with us.
We've really gone deep on this one, huh? From this magic treatment to the actual research and then all the real world stuff, access and actually getting it to people. Yeah, it's been quite a journey for sure. We talked about the huge potential of LA-ART, but also, the systemic challenges. We got to make sure it's available for everyone who needs it.
It's like we're at this, turning point. We've got this amazing scientific thing, but we also need to make it fair and make sure everyone can get it.
Exactly. And that's where the real work starts, right? We can't just be happy about the science and think everything will be fine. We need to be proactive, work together to make sure this actually helps people living with HIV.
So let's talk about those next steps. What do we need to actually do to make this go from, a research paper to actually helping people?
Well, we need to tackle this from a bunch of angles. First, got to deal with the money part. Sadly, these long-acting injectables, they're not cheap. So we got to push for policies that make them affordable, insurance coverage, public health programs, that kind of stuff.
Right. So cost isn't a barrier for folks who could really benefit from this.
That's it. And, we also got to think about the healthcare system itself. Like, not every clinic or doctor is ready to give these injections. We need to invest in training, making sure healthcare workers are comfortable and confident giving LA art to their patients.
So it's not just having the medicine, but having the whole system set up to actually give it to people the right way.
Yeah, totally. And then we can't forget about the human side of it, right? Stigma still affects how people living with HIV access healthcare, period. We gotta keep fighting those attitudes, create a welcoming environment so people actually feel okay asking for help.
It shows that science isn't enough, right? We need to change how we think and act so these discoveries actually make a difference.
Couldn't have said it better myself. And that's where all of you listening come in. You can be part of this change. You can support those organizations fighting for better HIV care. You can talk about stigma in your own circles, or even just stay informed about what's happening with HIV treatment and prevention. Every bit helps.
It's about spreading the word, pushing for better policies, and just being kind and understanding.
And remember, knowing more helps you do more. The more we understand about HIV and the people it affects, the better we can fight for real change.
So for those who want to learn even more, what should they check out?
Well, the actual study we've been talking about, it's in JAMA. That's a great place to start. And, there are tons of organizations doing amazing work with HIV and AIDS, like research, advocacy, support. We've got the International AIDS Society, PEPFAR, the Elton John AIDS Foundation. They're all making a real difference.
And don't forget about those local groups. They do so much to help people living with HIV directly. They're incredible resources.
Absolutely. Reach out, get involved. What you do, what you say, it matters.
Well, this has been a really eye-opening deep dive. It makes me feel hopeful about the future of HIV treatment, and honestly, it makes me want to do more to make sure everyone can get it.
That's the spirit. I've really enjoyed talking about this with you and everyone listening. Let's keep talking, keep learning, and keep fighting for a world where everyone with HIV can thrive.
I love it. Couldn't agree more. To everyone listening, thanks for joining us for this deep dive. Stay curious, stay informed, and stay involved. The fight for HIV justice continues, and we can all be a part of making a difference.